The number of coronavirus cases in the United States has officially topped 3,700 with 69 deaths. As government officials close schools and mandate closures of bars and restaurants, the Centers for Disease Control is recommending the cancellation of all in-person events of 50 or more people for the next 2 months. That means everything from sporting events and festivals to weddings and beyond. Joining us right now is Dr. Scott Gottlieb. He is the former FDA Commissioner. He's also a CNBC contributor, and he serves on the boards of both Illumina and Pfizer. Scott, you've been kind of guiding us through this almost every day. Where do you think we stand right now?
Well, I think right now, we're about 6 weeks. We're about 2 weeks into the process where between when China first identified community spread and then you had the lockdown of Wuhan. I think the difference for us is that we identified our community spread much earlier than China, and I think we're starting to take mitigation steps much sooner than they did. China did just about everything wrong during those 6 weeks. I think we're doing a lot of things right currently, notwithstanding the challenges we had getting the diagnostic tests deployed, which will be fully deployed, I think, this week. I think by the end of the week there's going to be much more diagnostic screening. I think the steps that the governors are taking right now, which are very aggressive, are going to absolutely impact the trajectory of this epidemic. I think we need to continue to do that. We need to have a difficult March so that when we get into April, this peaks out at some point in April. And if you talk to some of the folks who are modeling this, there is a sense that this is likely to peak sometime in mid to late April, and heading into May, we'll be coming down the epidemic curve. And the goal right now is to keep the infection rate as low as possible at any one point in time, so we don't exhaust the healthcare system, so we don't start having more deaths as a result of the coronavirus. I
think we need to emphasize what you just said. You expect this to peak in late April to mid-May. I mean, that's longer than probably a lot of people in the American public are expecting at this point. Lots of us are being told our schools are closed for 2 weeks. That doesn't sound like a realistic goal if what you're saying is right.
Well, I think the schools are going to end up closing for longer periods of time. I think they're announcing 2 weeks at a time, and they'll reevaluate the situation. In certain districts where there might not be community spread or evidence of community transmission, schools might make a decision to restart, although I think it's unlikely. But that's a good case scenario. This is going to be a 6 to 10 week process, and I think if we can get through this in 6 to 8 weeks and keep the peak of the epidemic below the point at which the healthcare system gets exhausted. If you look at what happened in South Korea, Italy, China, that was about the length of time that it took the epidemics to run the course. South Korea is much more successful at keeping the peak number of infections down. Italy is obviously losing control of their infections right now and of their epidemic. I think what we need to do is focus on how do we blunt the impact of the mitigation steps that we need to take to try to reduce the community transmission, things like closing schools, closing restaurants, closing bars, places where people go. So you basically slow down activity and people self-quarantine because they have no place to go.
Doctor, though, what you're saying, and this is what we've been trying to raise the issue of all morning, CEOs across the country are trying to put some timetable on this and looking at their balance sheet, trying to figure out what their run rate's going to look like. Can they withstand this, whether you're a small business or you're a big business? It sounds like you're effectively saying this is at minimum a 2-month situation, and when you really think about it, potentially 3.
Well, look, with
in terms of the social distancing that you're talking about.
Yeah, it's March 16th right now. I think if we continue to be very aggressive like we're doing right now, and we mitigate a very severe epidemic, and we don't seed multiple cities where we have simultaneous epidemics that are large in multiple cities. Seattle and New York look pretty well seeded right now. I think by mid-April we're starting to see this maybe peak out towards the end of April.
So
that's what the modeling shows.
Doctor, you sound better today. You said we need to do more things. We're not doing it yet. You sound like some of the stuff that's happened in the last 3 or 4 days has gotten you to the point where you think that we're doing more than we were and getting close to
I think that's right, but we can't take our foot off the brake.
Good.
Would you shut down domestic air travel?
No, but I would pull the volume out of the system. I mean, I would stop government employees, federal and state, from traveling. If you pull enough volume out of the system, you're effectively shutting down travel, but leaving it for people who absolutely must travel. You don't want to deny people their liberty, and travel is a form of liberty in this country. But I think we need to keep our foot on the gas here and not pull back. I think the governors are doing the right thing. They're taking very strong action. I would just say, if I can, we need to focus on trying to blunt the impact of this on people. Congress needs to do something to help get relief to lower income middle class workers who are out of paychecks right now. Individually, we also need to think about vulnerable Americans, older people who now are home without services, and how we can support them, because that's where the real vulnerability is. That's where you could see really adverse outcomes. And so we all need to think about what we can do to blunt some of the impact of the mitigation steps that are necessary.
Doctor, real quick, there are emails going around among investors all weekend also about this idea that there's a cure in the form of chloroquine phosphate mixed with zinc. Some people are saying it's misleading. Some people are not. Can you speak to that? There's a malaria drug that apparently has or is not being used in South Korea and potentially Italy. But there's a huge investment class, including some very bold-faced names, that have been looking into this. Yeah,
chloroquine. It showed in vitro activity in test tubes. It needs to be studied clinically. I wouldn't put too much confidence in it based on the data that we have right now. But just to pick up on the point that I was talking about with Becky, what this looks like, I think, in a good case scenario, we managed to keep the scope of the epidemic contained. It peaks out some point in late April. Heading into May, we're really coming down. July and August are relatively clear. Summer camps get canceled, but it's relatively clear. Then we're back in the fall, and there's outbreaks. But we're going to have, hopefully, a different toolbox in the fall to deal with that. Point-of-care diagnostics, hopefully, maybe an antibody-based prophylaxis for people who are vulnerable, like the product Regeneron's working on and some other companies. So we could have a very different toolbox in the fall that helps mitigate the impact of outbreaks if and when they occur.
Dr. Gottlieb, you said earlier that New York City and Seattle, you think, are well-seated, not well-situated. What does that mean?
Well, well-seated meaning that there's a lot of infection probably already in those cities, and we're going to have outbreaks in those cities, hopefully not of a proportion that you saw in Wuhan and the Hubei province, but fairly sizable outbreaks at this point. And I think that's why you're seeing those cities be so aggressive. I mean, New York has been far more aggressive, and New York State's been far more aggressive than, frankly, Seattle has been. I think Cuomo is doing an admirable job leaning into this. Those steps are going to have an impact. We're earlier than the Chinese were in discovering our community transmission, and we're taking aggressive steps earlier than them too. Now, that said, we have limitations. We can't lock down a city, or we shouldn't be locking down a city. But the good news is that we're taking aggressive steps, mitigation steps earlier, and I'm not so sure that these mass quarantines and lockdowns are actually that effective.
Very quickly, areas that have not been as hard hit as New York City and Seattle to this point, should they be doing social distancing there too?
Absolutely, because they want to prevent more widespread propagation in their cities. I think if you look at states like Ohio, Maryland, New York, where the governors are being very aggressive, I think it's going to have a real impact. There's other states where there seems to be some sustained community transmission that haven't been as aggressive yet, like New Jersey. I think they're a little further behind, but I'm pretty hopeful that all the governors are going to catch up and be working off the same playbook pretty soon.